The future of colon cancer treatment and how is rectal cancer treated according to stage. Colorectal or colon most cancers is a potentially deadly, unusual boom of cells within the colon and/or rectum, a long, muscular tube that is a part of your digestive gadget. Unluckily, colon most cancers is all too not unusual. If influences nearly future have a look at of colorectal cancer will refine our information of the genetics of the disorder. This in turn will cause in advance identification and remedy of high-risk people. The destiny may additionally in all likelihood deliver the usage of genetic interventions to interrupt the adenoma-carcinoma series. Increased cognizance of colorectal cancer by means of the general public and by non-public insurers, government businesses, and clinical employees will result in better use of available screening techniques. Improvement of preventive drug strategies in opposition to colorectal cancer, particularly with tablets that lessen polyp formation or save you polyp development to most cancers, promises to be a fruitful field of undertaking. There is sufficient cause to expect refinement of diagnostic and staging checks for the disease, perfection of surgical and non-surgical strategies for treatment of huge bowel cancer and its headaches, and enhancing chemotherapeutic treatment with the aid of more powerful and less toxic tablets. Some of molecular markers for colorectal most cancers can be measured, but it isn't always but clean that they've prognostic value or healing implications. Measures of DNA synthesis or mobile division are of uncertain cost as clinical selection-making tools. Measurement of thymidylate synthase hobby in colorectal most cancers tissue is one of several markers underneath investigation as a prognostic indicator. This may be beneficial in making decisions concerning using adjuvant chemotherapy for certain patients, particularly people with degree E or B tumors. Every other purpose could be to collect a hard and fast of markers for most cancers chance for an character who has adenomatous polyps. Presumably, such trying out should mirror publicity to colon carcinogens and help define the outlook for an person. This in flip may want to narrow the potential use of screening and diagnostic procedures along with colonoscopy. Techniques to become aware of micrometastases in lymph node tissue are in improvement. Those consist of unique stains for cytokeratin, which can perceive small clusters or unmarried malignant cells in lymph node tissue. Every other technique uses a technique referred to as PCR for detection of C in resected lymph nodes. PCR is a way which allows speedy replica of large portions of quick segments of DNA or RNA. Other techniques include the identity in lymph node tissue of oncogene, or tumor suppressor gene mutations, which occur inside the primary tumor. Such techniques may be of use in reclassifying sufferers whose lesions are tiers as E or B via traditional method and in deciding on them for probably life-saving adjuvant chemotherapy. Big medical trials will be had to decide if identification of micrometastases through these techniques indeed leads to more suitable remedy and improved progress. Expression of the enzyme COX-2 by colorectal cancers is relatively variable. Greater expressions of COX-2 via tumors are associated with lymph node metastasis, superior degree of most cancers, and poorer long-time period outlook for sufferers. Through article submission, there can be potential destiny software of this test as a method of staging and prognostication. How is rectal cancer treated according to stage? The colon is at the end of our digestive machine, with the rectum on the give up. The rectum stores the stool organized with the aid of our body for expulsion earlier than its miles taken out. Most cancers that takes place in it is known as rectal cancer. But, being part of the colon, it's also called colon most cancers, colorectal most cancers, and bowel cancer. Remedy of rectal cancer is likewise just like the treatment of colon cancer, however due to the fact it is also at its cease, there may also. The colon is at the cease of our digestive machine, with the rectum on the cease. The rectum shops the stool organized by means of our body for expulsion earlier than it is taken out. Most cancers that happens in it is known as rectal most cancers. But, being a part of the colon, it's also known as colon most cancers, colorectal cancer, and bowel cancer. Treatment of rectal most cancers is likewise similar to the treatment of colon cancer. However, considering that it is also at its stop, there may be a mild distinction within the remedy of rectal cancer. Remedy of rectal cancer depends on its level. In this text you may discover ways to treat rectal most cancers in keeping with the level. Colon most cancers treatment in India. Treating rectal cancer. First understand the way it happens. Rectal cancer can arise at any age, although it more often than not influences the aged. In this acute hassle, small, non-cancerous, benign, tumors normally arise within the colon or rectum. Over time, these non-cancerous tumors grow to be cancerous tumors and turn out to be the problem of rectal cancer. Gradually these tumors begin spreading in your colon or rectum, which determines the level of your cancer. Exceptional liver transplant health center in India. Why are tumors fashioned? Along with the trouble of rectal most cancers, additionally they recognize why a tumor is fashioned. Truly, in each a part of our frame, the method of manufacturing new cells i.e. cells and destruction of old cells pass on clearly. However, when the DNA responsible for this manner encounters a hassle due to any reason, this procedure is interrupted and new cells begin developing at a totally speedy pace, and vintage cells are not destroyed, causing inflammation at that location earlier. And then later the tumor develops. Prostate most cancers remedy in India. Remedy of rectal cancer. What are the troubles or symptoms as a result of it? Because of rectal cancer, many bodily troubles can appear to your body as its symptoms. Like modifications in bowel actions, bleeding with feces, rectal bleeding, bowel movement, interrupted obstruction in bowel motion, constipation or bellyache, weight reduction, fatigue or weak spot, stomach, gasoline problem, and many others. Treating rectal most cancers. How do doctors diagnose it? To deal with rectal most cancers, the physician first undergoes some checks to decide its degree or severity. Bodily exam and history, colonoscopy, digital rectal exam, DRE, biospy, endorectal ultrasound, PET experiment, MRI, court scan, X-ray. Organ transplant, medical institution in India. Treatment for rectal most cancers. What is the stage of rectal cancer? There are three elements of the colon or rectum in our frame. The first is the mucosa, the second one and middle component is the muscularis propria, and the final and outer element is the mesorectum. The mucosa is the inner part of the rectal wall, wherein the glands gift shape the mucus, which allows the stool to pop out from the rest. The muscularis propria is then the principal part of the rectal wall, which includes the muscle groups wanted for the rectum to be fashioned and shriveled. The mesorectum is then the outer part of the rectal wall, which is a fatty layer to offer safety to it. These three layers are followed via the lymph nodes present across the rectum, that's a part of the immune system, but protects the rectum or any organ of the frame from risky materials such as viruses or microorganisms. Stage 0. Remedy of rectal cancer relies upon its degree. In level 0 of this vital disease, a few ordinary cells begin to appear within the mucosa, the inner part of the rectum wall. Degree 1. In degree 1, the cancerous cells begin to unfold to the internal and middle elements of the rectum wall. However, the outer part of the rectum and lymph nodes remain unaffected by using this at gift. Stage 2. In level 2 a rectal cancer, the tumor or most cancer cells fall outside the rectum wall, i.e. the mesorectum, but the lymph nodes are nonetheless unaffected. This degree is divided into two components, 2A and 2B. Stage 3. On this degree of most cancers, the cancerous tumor spreads to the rectum in addition to the lymph nodes, and this stage is divided into 3A, 3B and 3C depending on the place affected. Stage 4. In degree 4 of rectal most cancers, the cancerous tumor spreads beyond the rectal or colon place and spreads to different parts of the frame. This level is the maximum extreme and threatening level of most cancers. Human beings also want to study. Dissolving fibroadenoma in India is now clean and affordable. How is rectal cancer dealt with consistent with the level? Rectal most cancers is handled according to its level. Let us recognize about it in element. Treatment of rectal cancer consistent with stage 0. Inside the remedy of this degree, the health practitioner eliminates the cancerous cells which have began growing within the inner part of the rectum or best a small part of this organ, for which he makes use of outside radiation remedy or internal radiation remedy. Treatment of rectal most cancers in keeping with stage 1. In this stage, the cancer has unfolded to the internal part of the rectum and enters the imperative part. In case you are antique or have a small tumor size, simplest radiation remedy can be used to deal with it. However, surgery is maximum effective for this stage. In keeping with level 1, chemotherapy can also be taken together with surgery to deal with rectal cancer. Remedy of rectal cancer in step with stage 2. In this level, the cancer spreads to all components of the rectum and also starts off-evolved affecting surrounding organs inclusive of the bladder, uterus and prostate gland. In this degree, radiation remedy is finished with chemotherapy to all organs affected by cancer and before or after surgical treatment. Shoulder substitute surgery fee in India. Remedy of rectal cancer according to level 3. Because in this stage the tumor additionally spreads to the lymph nodes, and in its treatment radiation elimination is achieved with tumor removal surgical operation, after surgical operation or earlier than chemotherapy. Remedy of rectal cancer according to level 4. Degree the fourth of may be very risky and tough to treat rectal cancer. Because, in this stage, most cancers has affected the rectum as well as other organs which include the liver or lung. The main treatment of this level is chemotherapy. However, the medical doctor may carry out tumor surgical operation with it. In this stage surgery is finished to prevent or lessen rectal bleeding, which can't be performed with the help of another alternative. However, surgery cannot declare its remedy, however increases the chance. Stem cell therapy will cure all these diseases and illness from the cells of the body. You can get in touch for more information. Please subscribe and share our YouTube channel. Thank you.